Hi, this is Dr. Marianne Iskander with Practically Pediatrics, and today we're going to talk about abdominal pain, which is a really big topic. It's one of the most common pain complaints that children will come to their parents with. We get a lot of calls about it in the office. And abdominal pain is, I think, a little stressful for parents because it can be anything from gas or, appendicitis. So you kind of never know as a parent, should I panic about this or should we just watch this for a second? So I'm going to help you kind of tease through which abdominal pain to worry about and which abdominal pain is less worrisome. So we are going to talk a lot about poop in this video. So let's get comfortable with poop. Caca. Doo-doo, crap, dookie, lard, the loaf, the nugget, the crud. You get it. Let's talk poop. Pooping issues is a very common cause of abdominal pain. There is a whole line of questioning we go down to rule out a pooping problem. So the first question is, when is the last time your child pooped? What did that poop look like? What was the consistency of the poop? Was it hard? Was it soft? Was it medium? Was there abdominal pain associated with the pooping? Did it take a long time for your child to get that poop out? Was there pain with the poop? Was there blood? What was it wearing? Just kidding. So what we're getting at is one of the most common causes of abdominal pain is constipation. So the definition of constipation is pooping less than 3 times a week. There is pain associated with passing stool. The stool is very hard, dry, sometimes pebbly. There is blood associated with the stool, and it requires a lot of effort to pass. So if there is constipation, let's talk about how to relieve the constipation. So number one, we're going to look at, of course, the diet and water intake. The most common things in your child's diet that is probably causing the constipation is, number one, we ask about cow's milk dairy intake. So a lot of milk, if your child is a milk lover, that cow's milk can start to dry up the poops. Cheese is a big one because cheese is usually cow's milk and salt and dry. So cow's milk and cheese are the first things to try to decrease or eliminate for a while, just to see if it makes a difference. The second one is the salty snacks. So chips, crackers, obviously it's dry and salt, so that's gonna dry up your poops a little bit. And then the dry starchy carbs, so rice, bread, tortillas, potatoes, cereal, and pasta. Those are the big ones. Most kids love carbs, but try to switch it out for whole grain rice, brown rice, high fiber pastas, whole grain pastas. Try to eliminate the bread and the tortillas and the potatoes as much as possible. Then you want to look at your child's water intake. So for younger kids, 16 ounces of water a day is probably fine, especially if they eat a lot of fruits and veggies. If they don't, they probably need a little more than 16 ounces a day. So make sure your child is drinking enough water. Diluted juice does not count. Skim milk does not count. It has to be water. Okay, what to give your child dietary-wise to help with the pooping? So the number one thing is fruits that start with the letter P or have a pit. Remember, poop starts with the letter P, has a pit, good for pooping. Those are the fruits you want to focus on. For example, pears, plums, papayas, peaches, pineapple, prunes. Those are good for pooping. And pitted fruits like mangoes, apricots, again, plums are good for pooping. And also berries, so blueberries, raspberries, blackberries, not cranberries for some reason, but all the other berries are great. Now, apple juice is usually good to help with pooping, and prune juice is usually good to help with pooping. You want to stay away from bananas. With veggies, you definitely just want to eat a lot of greens and high fiber veggies. You want to, again, stay away from potatoes and root vegetables if there is something to eliminate. from the vegetable section. Eating a lot of fruits and veggies, you still need the water to aid all that to pass. Okay, so that is constipation, which again is the most likely culprit of abdominal pain. One more note on poop. If your child is having soft poops every day or every other day, and it is effortless, easy to pass, and there is no pain, however, there is blood in the stool, you definitely want to call your doctor for that. That can be an inflammatory process in the GI tract. Other reasons for abdominal pain, well, it depends. Sometimes the location of the abdominal pain in the stomach can help guide us. So if your child is having pain after meals and the pain is kind of higher up right under the rib cage, that could be acid reflux, which is actually really common in kids depending on their diet. So acid reflux is from spicy foods, acidic foods, and just really fatty processed fast foods. So the acidic foods would be juices, for example, tomatoes, tomato sauces, and foods like pizza or spaghetti. The tomato is actually a really high source of acid, and chocolate is also very acidic as well. So you want to watch for just eating chocolate cookies or drinking a lot of chocolate milk, for example. And then the spicy snacks or the hot sauce, we usually need to take those away too. If your child doesn't eat any of that stuff, then you want to look for the consumption of like fast foods and fatty foods, which can also cause a little gastric upset. So those are the three big things if your child is having more upper abdominal pain. And then lower abdominal pain, well, it depends. Is it on the right or the left? If you have left-sided lower abdominal pain, again, that is your intestine and colon. So that's usually pooping problems again, or gassiness. So left side is, generally speaking, more benign. Right lower quadrant is a little more ominous. We worry about appendicitis. So that is usually one of the biggest fears for abdominal pain. Is this a surgical emergency or not? So appendicitis will usually start with vague abdominal pain around the belly button. And as it progresses, it will move to the right lower quadrant, which is kind of by the right groin. So if your child is having worsening right lower abdominal pain, especially with nausea or vomiting, and especially with fever, that's when you want to probably be seen in the emergency room to rule out appendicitis. For teenage girls, lower abdominal pain, either on the right or the left, could be associated with menstruation or ovarian cysts. So if the pain is getting really, really severe, you also might want to be seen in the emergency room just to look at your ovaries. When I say severe pain, I mean pain so bad that all you can do is kind of lay very still in one position. It hurts to move. It definitely hurts to get up and walk, and it is consistent and persistent. So if your child suddenly is doubled over and, oh, my stomach, my stomach, my stomach, and then after a few minutes, they're like, okay, it passed, it's gone. And even if it comes back, that is more reassuring than persistent, worsening pain so bad that you don't want to be touched or moved at all. That is the pain where you want to see a doctor right away, or at least call your doctor to see if you need to be seen in an emergency room. Also for girls, if their pain is low in the abdomen, right in the middle, kind of over their bladder, and they are also complaining of pain with urination, that could be a urinary tract infection. So you definitely want to call your doctor with abdominal pain associated with urinary discomfort, because we should rule that out as quickly as possible and get that treated sooner better than later. So that is abdominal pain in a nutshell. Thank you so much. I hope that helped, and I will see you soon.